November is recognized as Diabetes Awareness Month, and it's a time when we seek to bring attention to this medical condition. For us to better understand diabetes, we have invited Dr. Paul Wright to be our guest. Dr. Wright started seeing patients at the Diabetes Association of Jamaica in 1980, and he now assists the HEART Foundation of Jamaica with treating diabetics and other patients on Thursday and Friday mornings. Welcome to Kool Conversations.
Very good to be here with you this morning.
Greetings, Dr. Wright.
Okay.
And how are you?
I'm in good health, thanks.
Very good.
Praise the Lord.
That's a medical response. Okay. Now, we know that there are essentially two types of diabetes, types 1 and 2. But what is the difference between them, and where does gestational diabetes and also juvenile diabetes fit into that equation?
All right. Let me start with the different types of diabetes, diabetes 1 and diabetes 2. All has to do with function of the pancreas. The pancreas is an organ in the body that controls the secretion of insulin. In type 1 diabetes, the pancreas doesn't work at all. So you don't have any insulin. And therefore you're going to need insulin. Insulin is only working by injection, which no Jamaican likes to hear.
I know.
Okay?
I know.
So the juveniles, those are the young people who have diabetes, is almost 99% of the time because of a lack of insulin being produced by the pancreas. And juvenile diabetics need insulin in order to bring their blood sugar under control. Type 2 diabetes now is the other diabetes where your pancreas was working, but now not working as well as it should. And you need something to help the pancreas to bring your blood sugar down to normal. That is type 2 diabetes. And you have different forms of medication. You take medication before you eat to bring down to keep the blood sugar normal, or you bring medication after you eat to control what you have eaten, because what you eat is what makes your blood sugar go up.
Yes.
Because it is the food that pulls the blood sugar up. There are some people who say, Doc, my blood sugar go up because a man quarreled with me this morning, and that's really nonsense. It is what you eat that puts the blood sugar up. And therefore, in controlling your diabetes, your number one thing is to what you eat. You have to stay away from the sugars. And we all know that in order for food to taste nice, it must taste sweet. And that is what attracts people to what is sweet. And diabetics have to stay away from all the sweet things that they can avoid as much as possible, which is very difficult.
It is.
And it takes time to get used to that. But most diabetics who understand the necessity to stay away from sugar get used to the no sugar taste. It takes about 2 to 3 months, but then they do quite well. Because you have to get used to the taste, because all your life you've been having sweet drinks. And one of the problems that the government has is with children and sweets. As you know, the government cannot control who sells food on the outside of the school. And that is where the children go for snacks, and the snacks are usually laced with sugar, because sugar is what they want. But sugar in children can prone to diabetes and hyperactivity. You know, they give children sweetie all the time. Why you don't stay quiet? But you just give me sweetie. Children won't say that.
But we know what you mean.
But you know it is sugar that gets them hyperactive. And we always try to tell people, you know, even if your child is not a diabetic, don't give them sugar in the night. Because they're not going to fall asleep, or they're going to fall asleep and wake up. And you know, if they wake up in the dark, it's you them coming too. So you're not going to get much sleep. So you have to understand how sugar operates in the human body. But in diabetics, it is a bad thing. And remember all the time, the sugar only goes up by what you take in. So you have to be careful of what goes into your body if you are a diabetic.
So, based on the statistics, diabetes mellitus or mellitus is the second leading non-communicable disease. Approximately 70.5 deaths per 100,000 population, and it's the most prevalent among Jamaicans 75 years and over, approximately 42%. Now, in 2014, the prevalence was 11.9% among those who were 18 years and older. How serious a problem is diabetes to Jamaica's health system?
Extremely serious problem, because the diabetics don't know that they are diabetic. And therefore, the HEART Foundation and the Diabetic Association runs a program named Know Your Numbers. If you know your numbers and you are able to take your blood sugar test on a regular basis, even with a pharmacy, because we have now these shows where pharmacists will say, come in and we will do your blood sugar for you free of cost or with a small minimum cost, or you go to your doctor for a broken foot, just ask him to test your blood sugar at the same time. It is to know your numbers, and you have to know what is normal and what is abnormal. And in Jamaica, we have two systems where we measure blood sugar: the milligrams per deciliter and the millimoles per liter.
Okay.
One is the English system, one is the American system. The one that is most prevalent out here is the millimoles per liter. And the normal number there is between 3.5 and 7.5.
Okay.
And you must remember there has to be a range, because you don't want to say, what if it is not this number, then something is wrong. The range is between 3.5 and 7.5 millimoles per liter. Those who use milligrams per deciliter, which is the American system now, that is 70 to 140. So there's a range of numbers that you can get in order to be normal. Below 70, you are in trouble. Above 140, you are going to be in trouble. Below 3.5, you are in trouble. Above 70.5, you are going to be in trouble. So it is know your numbers and get your blood sugar tested on a regular basis. Now, the best way to test your blood sugar is when you're fasting, when you're not eating, to see how your body has managed the food that you had the day before. Is the pancreas working inadequately to bring down the blood sugar or not? If you're a diabetic, what you need to know is what happened to my blood sugar after I've eaten and after I've taken my medication, which is about an hour and a half to 2 hours. So diabetics now, it don't make sense. You get up and you say, what my blood sugar is. Oh, it's normal. I don't need to take my medication. Nonsense. Your medication is going to be needed after you eat.
Yes.
And after you take your medication, and then you check your blood sugar to find out if it is working. It makes no sense to be a diabetic, put on medication by the doctor, and don't know if it is working. And the only way to find out if it is working is to test it 2 hours more or more after you have eaten, after you have taken your medication, and get the number between 3.5 and 7.5 millimoles per liter, or 70 to 140 milligrams per deciliter. Those are some of the things that you have to know. Because a lot of people say, boy, I went to the doctor, I need the medication, I take the medication, and I'm feeling okay. You're not okay until you test the blood sugar and know your numbers. What number do I get today, and is it correct?
I know several individuals perhaps want to own their own blood glucose monitor.
Excellent.
How do you get access to it?
Easily. You join with the National Health Fund, which I think they have their headquarters in New Kingston, Dominica Drive, I think is where the headquarters is.
Towers.
Register, your doctor will send you a form and you register. I am a diabetic, you get the machine free. All you have to do is buy the strips that you use. You get the machine from the government free of cost. You just buy the strips, and they will show you when they are telling you the thing, how to get it. Most pharmacies will sell the machine and the strips, because they have to make a living like everybody else. But they will sell you, and every pharmacist has different machines. And the most important thing is that the machines are made by different manufacturers. But you have to have the specific strip for your machine. Because what many people do, they get the machine from the government, strips finish, they go and buy a strip, a set of strips from the pharmacy, of no use to them because it's of a different machine. So you carry a machine when you're going to purchase your strips. This is the machine I'm using. Can I have the strips for this particular machine?
That's an important point. Thank you ever so much for that information. Now, how does diabetes affect the organs of the body?
Every organ of the body is
affected. The eyes, the feet.
Every organ of the body is affected. When you swallow your food, It goes down the esophagus and enters the stomach. The stomach crushes the food and secretes acid at the same time. When it reaches the consistency of something like thick porridge, a valve opens, it pushes the food through the small intestine.
Okay.
As the foam is going through the small intestine, it's by a process we call peristalsis, which is a milking of the tube, because you know intestines are tubes.
Right.
They have big tubes and small tubes. It goes through the small tubes, the small intestine, by peristalsis, and in that process, the body takes out what it wants. It really don't matter what you eat, you know. The body is interested in protein to build, carbohydrate, which is the fluid that is going, the fuel that is going to run the system, and fat, which is going to store for emergency energy. The carbohydrate is the sugar. Okay, that's what it's interested in.
Okay.
You have vitamins and so on that will come in, but then it enters the large intestine. 4 foot of large intestine, and all the large intestine is take out water. So when it reaches down by the anus, it comes out as solid.
Yes.
If it is coming out as liquid, large intestine not working, and you treat the large intestine and you get diarrhea, and you know how to treat that. But in that process of going through the digestive process, the blood, the sugar, carbohydrate enters the blood. Your brain is a computer. Excellent computer. Right? It is programmed for this before when you are born. It detects that the blood sugar is too high. It is 10. It sends a signal to your pancreas, who then releases the right amount of insulin to bring the blood sugar down to normal, so that whenever you test your blood sugar, it is going to be between 3.5 and 7.5 or 70 and 40. So that's how the system works. So if your blood sugar goes up after you have had your malt or your sweetie or whatever it is, and the brain sends a signal to the pancreas. The poor pancreas not working and ignores the signal, a busy signal. It ignores the signal, so your blood sugar stays high. The high blood sugar now is in the sugar is now in the blood, and that goes to the different organs. And when your blood sugar is higher than 7.5, it damages the cells in the organs. Okay. The organs have many millions of cells. So if your blood sugar goes up to 8 or 9, probably damage 5 cells. In an organ that has 30 million. No big thing. Not a thing wrong with you. You live normal. Next week, you kill 10. You have 16 million. But it is that slow, progressive killing of cells that eventually the organ cannot do the job it's supposed to do. The eye can't see so properly, and we need glasses. You keep changing your glasses because you're not looking about your blood sugar. Your kidney is not working anymore. You're going to need dialysis. Your heart not working anymore. It don't stop. It fails. You're going to need medication to bring the heart, to bring your heart under control, diuretic. So every organ is being affected. Skin. Your skin will break out in sores. That the doctors will have problems healing because you can't heal because your blood sugar is too high. So it's a multifaceted thing that goes wrong when your blood sugar is high. And the problem with it, it is slow and insidious. And while the damage is being done, boy, that me all right. Nothing wrong with me. Except some subtle signs that you have to be alert to pick up. You find yourself getting thirsty. You always need to be drinking. Okay? But the time hot. Dr. must drink powder, you're not so much hydrated, okay? You're going to find yourself always catching a cold. Some little small things, little cold turn out into a bad cold, things like that. You're getting up at night to pass urine when you never usually do to get up at night. You start to yearn sweet things, always want to yearn sweet things. So there are some subtle changes that take place that unless you are alert to what is going on, you never really know that you're a diabetic until some serious signs begin to come now. Then you go to the doctor, you're a diabetic, the problem starts, and they start you on medication.
The challenges that diabetics face, where as a patient in managing their condition, is it that drugs are too expensive? Is it that there are not enough doctors who can provide guidance on how to treat diabetes? Is it that patients are being misdiagnosed? What are you seeing?
Let us start with the simple ones. Expensive, okay? You join the National Health Fund, the reduction of medication for diabetes is tremendous. So you need to be aware of these things that will bring down your blood sugar. the better, the more effective medications are the newer medications. They are expensive. So it's a two-edged sword, because the people who produce these medications, they have to pay the people who do the research to get the thing. So it starts off, they have to get back their money. So they put a patent on it, and the patent is for 5, 10, 15, 20 or whatever. Nobody else can sell that drug until they get back their money. Then you can get the generic to buy after that.
So that's when the generic trips in.
They have to get back the money that they were spending to produce the drug in the first place. But once it is now well established, and you can get the generics, which is 1/10, sometimes 1/10 of the price as it used to be. So you have to be aware of that, and you can ask your doctor for generic drugs that have been on the market for some time and no longer attract the extra cost that the manufacturers are going to do in order to recoup their loss, what they did in order to produce the drug that is doing the problem. The next thing you have to talk about when the drug is not knowing that you're a diabetic. And the only way to know you're diabetic is to know your numbers and to do the test. The problem with the test is a blood test.
Yes, and we
don't
like...
Jamaicans are dead scared of injection. If them a blood test, they said, can I test the urine? The urine can give you an idea, but the urine is notorious for giving you wrong results. Wrong results. There are people whose blood sugar don't turn up in the urine, and they say, boy, the doctor checked my urine and I don't have sugar. But the kidney not working properly, that's why it don't come out in the urine. So most people have stopped doing urine tests. The blood test is much simpler, get a bit more accurate result. It's just the fear of that stick. That is what is causing the reluctance in order to do injections and so on. So you can imagine when I tell a patient that he needs insulin, get up from the floor, sir. You can't stay there right now. You didn't faint, did you?
I've often wondered how they and the numbness that must be created if you're constantly required to stick your finger, or you have to give yourself the insulin injection.
Yeah, twice a day.
That
sometimes 3 times a day. And people, I tell you, they try to find ways of not doing it. And that is why the blood sugar gets out of control. That is why we have the problems with diabetes.
Yes. Okay. Right. Now, let's now look at Jamaica. Jamaica, you know, this is not a real place. But at least back in the day, I used to hear diabetics saying that they have to eat pumpkin. Now, pumpkin and diabetes, because is it a good food or a bad food? Because I know it has a high glycemic index. Do you or don't you eat pumpkin?
All right, let me tell you about the food now. Jamaicans' food is worldwide popular. In fact, people who come to Jamaica say that we are the only country in the world where we eat dinner for breakfast. There's no other country in the world that breakfast is rice and peas and saltfish and ackee and saltfish and liver and banana. You want to toast an egg. You know? Yeah, so we are the only people that do that. And our food is tasty. But as you pointed out, high glycemic index foods. They make the blood sugar go haywire, and you don't know that you're having something that is going to make your blood sugar go haywire. So what we have done at the HEART Foundation, we have a food guide.
Yes. Okay.
This is not a diet. It's a food guide telling you about high glycemic index foods. And we have 3 levels: the high, the moderate, and the normal.
Yes.
We have those levels. And we have at the back a list of the normal, the medium, the high, and the very high. Okay.
And is it culturally appropriate? It's a Jamaican type
This
food.
is Jamaican.
Good.
Okay. Now, there are some foods that are missing on this, which I write in ink and tell the people. Number 1 is pumpkin. I try to get my people, because if you even just have a cold, You know, I get no pumpkin soup. Man, I tell you, man, my auntie drink pumpkin soup last week. She nearly dead. By tomorrow, she better. So you get pumpkin soup and all that. I tell my patients who have problems controlling them, do you have pumpkin? When I must eat pumpkin, I stay away from pumpkin. Number 2, cornmeal. As you swallow cornmeal, your sugar double.
Ooh.
Irish potato.
Yes.
As you swallow Irish potato, your sugar double. Irish potato is bad. Sweet potato is good. So you have to know that. Yellow yam.
Oh,
as
goodness.
you swallow yellow yam is bad. White yam is good. And white ham has the most profound names in Jamaica. Slipper off a fork. You know about one? Slipper off a fork?
No. I know some other names.
Swallow me easy. All those are white yam, right? Negro yam.
Yes.
Those are good. That's a good yam. Okay.
Oh.
White bread. White bread is high glycemic index food. White rice.
Yes.
It's high glycemic info. So there are a lot of things that you have to do. This fruits now. We all need fruits, right? I tell my patients, because I found this out in my years of looking after the clinic, if you mix the fruits, things go haywire. So you can have your orange in the morning, you can have your bright banana in the morning, you can have even your watermelon in the morning, but not have orange and a bright banana and a fruit salad. That does going to make your blood sugar go haywire. Okay? That is my experience. Okay? So I tell them, have your fruits, but one fruit. Don't mix the fruits. In the evening, you have a different type of fruit. But fruits are important because you get a lot of minerals and other things that you need in your body from fruits. But the high glycemic index food is what I think get most of the patients because they come in frustrated.
Yes.
They eat what you're telling them to eat. They have no sugar. You show me sugar, me just collapse. I don't have no sugar, but I can't control my blood sugar. What you had? Well, I had some yellow yam. And that is where the problem comes in.
You know, and once again, we're talking to our people. If you're on the road, you'll see all of these fruit vendors, you know, they parcel up the peeled orange with the banana and the thing. And it's a grab and go kind of food. You see people on the way to work, flagging down the vendor, handing over the money and collecting a bag. This idea that we have, that we must eat our fruits first thing in the morning before we eat anything else, how does that affect your blood sugar? That is causing it to spike?
If it's a very sweet fruit, nowadays in the drought, now the fruits go ballistic in drought. They get very sweet. Okay? So the best thing for fruits is first thing, to have the fruits first before you have your meal or whatever it is. Because that way you get the benefit of the fruit. But if the fruit is too sweet, you're going to mess up your blood sugar. And remember, there are 2 types of medication, oral medication, one before and one after. Metformin is usually one after, but all the other ones are usually before you have to eat, so that it is in the body waiting for the sugar load to reduce it so that it don't damage the tissue in the body.
Okay, as we get closer to the end of this interview, common misconceptions about diabetes that you are just so tired of hearing.
Boy, I just have a little sugar, doctor, right? My blood sugar is 8. That's not bad, doctor. 7.5, 8. Yeah, right, man.
Yeah, just outside of the range.
But it is relentless. Anything over 7.5, you're damaging the tissue. And it is constantly 8, 8.5, 9. I have seen doctors tell patients, 8.5 not bad, okay? That is correct. So extent is not bad. But it is the constant 8s and 8.5s and 9s that eventually develop into problems, okay? So this liquid sugar that I have, that's something, you know, most of the time, you have to be very careful of that. Diabetic people they have an idea what is happening to their blood sugar. So if they feel themselves getting what they believe is low blood sugar, then they pop a sweet in their mouth or they go and have a sweet drink. I tell them that you must always get a number to associate with what you feel.
Okay.
Because sometimes high blood sugar produces the same symptoms as low blood sugar.
Oh.
The dizziness, the not feeling so well, the sweats and so on. But my sugar low. Well, I'm going to buy some ice mint and boom. Blood sugar was 30 already.
Okay.
So it got to 50. So associate because different people respond differently. So when your body is telling you that something is wrong, just find out what is the blood sugar level that this. Is it that it is high, why I'm feeling this way? Or is it that it's low, why I'm feeling this way? And so you can react accordingly in order to know what to do. The other thing that you have to be careful about now is bruises and cuts, especially in a diabetic, because there is a great correlation. When I had black hair, which is many years ago, I used to do orthopedics at the university. And one of the things that we used to have a special day was for amputations.
Oh, goodness.
Prof. Golden used to have the orthopedic people do amputations because we were trained to do it in a certain way so that they could go up to mono rehab and fit the prosthetic limb.
Yes.
Surgeons doing amputations just take off the leg and stitch it up. But Professor used to make us in orthopedics do all the amputations so that we could produce the stump to such an extent that they didn't have a problem when they're going to fit the prosthetic limb. And therefore, we used to do all the amputation, and it was a problem because we'd have the trauma list, the other orthopedic list, but we used to have Theta 4 for amputation because of diabetics and people who didn't understand what was happening to these bruises. Don't control it, don't take the necessary treatment for it, get out of hand, and poor circulation also we're having for amputation. So those were some of the things that we noticed. He used to have these Sunday sessions once a year where I would go there and talk about caring the feet, how to cut the nails of the foot, how to make sure that you don't damage the edges of the cut. That is how the amputation started.
Now, you know,
incorrect cutting of the nails, not looking after your feet. You have corn. What the people used to do in the country is they pare the corn and create cuts and bruises and so on. Wear ill-fitting shoes. Oh, yes. Walk barefoot in the rain. Wear in the water. You put the foot and you get a cut. You're diabetic, so you don't notice that you get the cut because in the water you don't see the blood. When by the time you come out of the water and walk in, the bleeding stop. Yes. So you don't know that you had a thing, but you were in dirty water. So you're going to get infected. So.
Now, leave us with a success story.
Oh, Lord, we have them all the time. People who have been going to doctors, not feeling well, complaining of not breathing properly, always having these things. And doctors now, put it this way, if you come in with a broken toe, with a broken foot, okay, they fix the foot. They really have no interest in your blood sugar or your blood pressure, okay? You come in with a broken hand, you fix the hand, you send home the person, okay? It is when something not healing as fast as you do, then something clicks and says, maybe I should do this. So it depends on what you say to your practitioner, okay? If you go in and say, this is what the problem is, he's going to focus on what the problem is, and he's going to fix the problem is. Some of us, including us older doctors, everybody that comes to my office gets a blood sugar test and a blood pressure test. Doctor, we'll get your blood sugar for man. See my knee swell up, man, what do you?
What's the connection between this and my knee?
Yes. Man, you charge me for this, you know. But it is things that you have. And so those are some of the success stories. People who have been going to doctors, not doing anything, they come, somebody do the blood sugar, do the thing. Doctor, I'm a new person. Or just change the medication. These new medications now do such a great job is that even though your blood sugar is under control, you're feeling lethargic and so on, these new substances that they have now discovered, that they put with the metformin and they put with the other drugs, you're a new person. And so those are the success stories that we have in diabetes.
So we're literally telling you take action to prevent diabetes. Our wonderful guest today, Dr. Paul Wright, made it very entertaining for you. Thank you ever so much for tuning in to another cool conversation as we looked at the topic of diabetes. I'm hoping you learned a lot today. We covered a lot. Please share the messages that you have garnered from today's show. On behalf of all of us at Kool 97 FM, and I'm going to extend it to the HEART Foundation of Jamaica and the Diabetes Association of Jamaica, thank you ever so much for opening your minds to the subject of diabetes, what you need to do and what you need to pass on as information. Till next time, I'm Diane Thomas.